Hello everyone, very warm welcome you all to my YouTube channel. So today we are learning about the vaccine which prevents us from pneumonia. So this is pneumococcal vaccine. So without further delay, we are starting with pneumococcal vaccine. So what is PCV? PCV is pneumococcal conjugate vaccine. It protects us from Streptococcus pneumoniae, prevents diseases like pneumonia, meningitis, otitis media and bacteremia. So my next question is PCV a live vaccine? No, PCV is a kill inactivated conjugate vaccine. Polysaccharide antigens are conjugated to a carrier protein like diphtheria CRN197. So tell me, what is the difference between PCV10 versus PCV13 versus PCV20? PCV10 has 10 serotypes, PCV13 has PCV10 serotypes plus 3, 6A and 19A additional serotypes. PCV20 is new, adds serotypes 8, 10A, 11A, 12F, 15B, 12, 22F and 33F. In India, public sector national immunization schedule, we are using PCV10, that is Pneumocil. In private sector, we are using Prevnar, PCV13 and PCV15 or PCV20 are used in Western countries. So now tell me, what is the storage criteria for this pneumococcal vaccine? It is stored 2 to 8 degrees Celsius, don't freeze, sack before use and suspension is vial or syringe. Dose of pneumococcal vaccine is 0.5 ml given intramuscularly and anterolateral aspect of thigh. Is there any side effects? Yes, pain, fever and irritability. And what are the contraindications? Severe allergy to previous dose is contraindication for PCV vaccine. What is the immunological advantage of conjugated vaccine? Conjugated, it is T-cell dependent memory response effective in infants less than 2 years, effect on nasopharyngeal carriage. So this is advantage of conjugated vaccine. Now we see most important thing, that is vaccination schedule in India National Immunization Program. First dose is 6 weeks, second dose is 14 weeks and booster dose is given at 9 to 12 months of age. Now we are learning about polysaccharide vaccine, that is unconjugated vaccine. So what are the limitations of unconjugated vaccine? That is PPVSP 23. It is T-cell independent vaccine. There is no memory cell generation, cannot be used in less than 2 years of child. So not helpful in preventing invasive pneumococcal disease in vulnerable infancy period. Does not have any effect on nasopharyngeal carriage, does not protect from acute otitis media, non-bacteremic pneumonias, efficacy is moderate, not more than 2 doses can be given as more doses causes hyporesponsiveness in this unconjugated vaccine. So these are limitations of unconjugated and polysaccharide vaccines. So now tell me, what are the high-risk children groups need pneumococcal vaccine the most? So these children are sickle cell disease, functional or anatomical asplenia, immunocompromised children, HIV positive, before cochlear implants, CSF leaks, chronic lung disease, including asthma patient, which high-dose steroids were given, congenital heart disease, cyanotic heart disease, chronic renal disease, CKD patients, chronic liver disease, diabetes mellitus. So now, what is the schedule of using PCV or PPSV23 in high-risk cases? At present, PCV13 and PPSV23, these both are used in high-risk cases. Don't use PPSV23 before PCV13. Keep a minimum gap of 8 weeks between PCV and PPSV23 vaccine. After completing all age-appropriate recommended doses of PCV10 or PCV13, these children, this high-risk group of children should be administered PPSV23 at age more than 2 years एंड एटलीस्ट 8 वीक्स आफ्टर मोस्ट रिसेंट डोज ऑफ पीसीवी. जैसे कि पीसीवी अभी दिया है तो 8 वीक्स के बाद ही पीपीएसवी 23 दे सकते हैं, और अभी जैसे पीपीएसवी 23 दिया तो उसके बाद 5 साल के बाद रिपीट करना है. सो फॉलोड बाय 1 more dose of PPSV 23 after 5 years from first dose of PPSV 23. Now for children between more than 2 years to 6 years of age, if age appropriate doses are not completed, लेस देन 3 डोजेज रिसीव्ड इन पास्ट, मतलब कि जो बेसिक नेशनल इम्यूनाइजेशन शेड्यूल है 6 वीक्स, 14 वीक्स एंड 9 to 12 मंथ, वो बेसिक भी कंप्लीट नहीं किया है और लेस देन 3 डोजेज ही लिया है, तो क्या करना है? तो 2 डोजेज ऑफ PCV13 देना है एट इंटरवल ऑफ 8 वीक्स, followed by PPSP after 8 weeks of second dose of PCV. Then after 5 years PPSP का डोज रिपीट करना है. और अगर इफ़ 3 डोजेज वर रिसीव्ड इन द पास्ट, मतलब कि पूरा बेसिक इम्यूनाइजेशन कोर्स लिया है, तो ओनली 1 डोज ऑफ PCV13 एंड फॉलोड बाय PPSV 23 dose after 8 weeks interval, and then after 5 years repeat the dose of PPSV 23. For children of 6 to 18 years of age, single dose of PCV13 is given and followed by PPSV 23 after 8 weeks. Later, after 5 years is given. So this is for high risk children. So this is all about pneumococcal vaccine. Thank you.